What is multiple sclerosis? It is a demyelinating disease. Demyelinating means what? Around the nerve, you can see here there is myelin sheath. That you can see myelin sheath is disturbed here. It is damaged. This is demyelinating disease, mostly autoimmune condition. Let's take a multiple sclerosis quiz, people. What do you say? Because my relative called me last night and told me that his wife has problems in vision. Okay, so they went to an eye doctor, and then I think they found no problem with the eyes as such, but the optic nerve or some problem. So they did an MRI, and the MRI has come with suspicion of multiple sclerosis because of some plaques, etc. in the brain. So what is multiple sclerosis, people? Now tell me. Demyelinating disease. Very good. Autoimmune mostly. Okay. So the nerves are getting demyelinated, remember. So now let's answer these questions. Question number 2 we will start with. Okay. Multiple sclerosis affects the central nervous system. Which part of the central nervous system is it usually attacked? I already told you the answer. So look at it. It's a demyelinating disease. So this is the answer. Okay. It will affect the myelin sheath of the nerves. Which age groups is multiple sclerosis most likely to strike? Tell me the answer, people. I told you she is my cousin's wife actually. So you can guess this. Adults age 20 to 40. Very good. Although the exact cause is not known, what factors will play here? Autoimmune condition. Definitely you will say viruses, genetic, environment. So all of the above. All of the above. Okay. Remember, virus, genetic, environment, autoimmune. Okay. Next. 5th question. How does the disease usually progress? So what do you think will happen for her? So she will progressive disease with some remissions, relapse, all that. Then, so this is how it will be. Attacks and remissions, gradual decline in function with no remission. Some people don't have remission. Gradual decline in functions will happen. Disease does not get worse is like very, very, very rare. So we'll go with all of the above. Okay. Very rarely the disease does not get worse. Okay. But mostly it is that progressive only. Question number 6. A person with multiple sclerosis who wants to have children should be aware that her disease may affect her pregnancy in what way? So here's the answer. I think you wanted to read the answer, but I'll give you the answer anyways. Multiple sclerosis symptoms will become a little less during in late pregnancy, but after childbirth it'll get worse. And especially if she's taking medication, she should definitely consult a doctor. She should, during organogenesis before getting pregnant, and the first 3 months it's better to avoid some drugs. Okay, so please talk to your doctor. Question number 7. What are the symptoms of multiple sclerosis? I told you now. He called and he said what? She had blurred vision. As of now, only this is the symptom. Will she become muscular, weak, partial paralysis, tired, fatigue? Yes. These are also symptoms of multiple sclerosis. Very good, people. Actually, I have a lot of tiredness. No, that time I checked, I only saw that I have problem with vitamin D. Otherwise, I didn't do any MRI or something for myself. Okay, as of now, I'm fine. Which, if symptoms of and physical exam suggest multiple sclerosis, how does a healthcare provider confirm it? Like I told you, they took my cousin to an MRI, and in the MRI, it showed some plaques, etc. in the brain. So now they have put a possibility that it is multiple sclerosis. Next, they will do a spinal tap, cerebrospinal fluid analysis to check for antibodies, etc. Visual evoked potentials, that is the brain's response, they will check. And yes, the answer is all of the above. Very smart you are, people. Question number 9. Take a deep breath. Only 2 more questions. Which therapy is often recommended for treating slowly progressing MS? Here it is slowly progressing. So they're saying don't give all this at all. Steroids also don't give, they're saying. Okay, slowly progressive means no need. But actual treatment is what? Disease modifying agents. Okay. Then, which of the following therapies is not recommended? You should not give snake venom to these people. You should not do a hysterectomy to these people. You should not remove some dental fillings. You should not do all this. So this is a joke type of question. You should not do any of these for MS. Okay. Answer. Submit. Yay! I got 100%. Wow. While we are here, let us look at what Davidson latest textbook says. It is a neuroinflammatory disease. It is treatable, they are saying. Interestingly, they are saying it's treatable. Okay. This is the latest edition and they are saying it's treatable. Symptoms will be like optic neuritis, transverse myelitis, brainstem syndrome, cerebellar syndrome, and other things. Optic neuritis, you can understand, inflammation, optic nerve. Transverse myelitis, something to do with spinal cord. Brainstem syndrome, something to do with brainstem. And actually, this seems to have some portion, subtype of strokes, they are saying. It is cerebellar syndrome, I think, is something to do with ataxia. Some ataxia will be there in that. Some gait issues, right? Look at the MRI here. They're showing in the paraventricular area. That means around the, in the side of the ventricles, how there are multiple high signal lesions. This is one image. Look at the other image here. Here they are saying that some gadolinium enhancement, recent lesions, active inflammation. B is showing older lesions. Wow. Gliosis. You have to look at all that, people. As of now, the multiple sclerosis in my cousin's wife is not confirmed. They have done only MRI, like I told you. And see how the disease is. Zoop up, zoop up, zoop up. And where is the one that doesn't progress, doesn't get worse, that they have not shown? Everything seems to be going in the bad direction only. And is this with treatment, without treatment? That they didn't tell, right? Progressive multiple sclerosis, progression. I'm thinking this is all without the drugs. So look at the investigations that she is due. MRI done, myelography. Will you check the study the myelin sheath? Visual evoked potentials that everybody is telling. Cerebrospinal fluid examination for cell count. Protein electrophoresis. Oh, you will do an electrophoresis of the protein and you look for some oligoclonal bands. Oligodendrocytes. You remember who's going to make the myelin sheath, etc. And then you'll exclude other conditions by doing an X-ray, chest X-ray, serum vitamin B12, because vitamin B12 helps in all this myelin sheath, I'm thinking. Anti-nuclear antibodies, antiphospholipid antibodies, AQP4-MOG antibodies. What are these? This is also something to do with optic nerve, especially some eyes, especially only. Okay, so these are the investigations she may need to get done further. Now let's look at management, people. Investigations over. Now let's look at management very quickly. Like I told you, you have to do what? Disease modifying treatment, DMT. Ocrelizumab, natalizumab, all these MAB. What is MAB? Antibody. Monoclonal antibody, right? That is MAB. Moderate efficiency, you have some drugs here. You can read the names. Lower efficacy immunotherapy, you can read the names. Interferon beta, something, something. In acute relapse, people, they will give this GlucoCorticoid that we already read, remember, in the MCQ. And specifically what symptoms the person has, complication, disability, those specific things you will treat. They have to stop smoking, etc. That and all you can write. What complications will occur in these people? They will have pain, dysesthesia. Dysesthesia means what? Unusual touch-based sensations. Sounds like some neuropathy, right? Walking speed, I think it will be reduced. What do you say? Bladder symptoms, erectile dysfunction, spasticity. So this is for men, right? Erectile dysfunction, spasticity. Tightness of muscle due to prolonged muscle contraction, spasticity. And why is all this happening? Because of demyelination of the nerve. In what? Central nervous system. This is the demyelinating plaque. So in the report of my cousin's wife also they have written like this, plaque. So hopefully everything will get resolved and it is just some vitamin B12 deficiency, hope. Let's see. And for now, let me sign off from Multiple Sclerosis video. Bye-bye.